वेलकम टू दिस चैनल। आज इस वीडियो में हम बात करेंगे डिस्चार्ज सर्टिफिकेट कैसे लिखा जाता है। अगर आप साइकेट्री डिपार्टमेंट में काम करते हैं तो डेफिनेटली अगर आप साइकेट्री डिपार्टमेंट का पीजी रेसिडेंट है तो ये वीडियो आपको डेफिनेटली हेल्प करेंगे। डिस्चार्ज सर्टिफिकेट में सबसे इंपॉर्टेंट है कि डिस्चार्ज देता कौन है, हु विल एडवाइज योर डिस्चार्ज, दैट इज बीपी, दैट इज कंसल्टेंट। कंसल्टेंट विल एडवाइज, यू नीड टू नोट इट ऑन progress report. Okay, in progress report of the patient, whenever you will see in the round, you will write that case seen by I am writing in short form, case seen by BP doctor, whoever it is, and advice is discharge on advice. Now discharge can be of this type: discharge on advice, discharge on request, LAMA, that is discharge against medical advice, and LAMA, that is leave against medical advice. Now discharge on advice and discharge on request is almost same, but in discharge of request you need to slightly modify one or two places, and you need to take 3 signature of the attendant. Remember, 3 signature of the attendant कहाँ लेंगे ये हम बताएंगे। ठीक है, दिस इज द डिस्चार्ज सर्टिफिकेट। अगर आप डिस्चार्ज ऑन रिक्वेस्ट ले रहे हैं तो यहाँ पे आपको लिखना होगा डिस्चार्ज on request. Now this you can write here also, and someone may ask you to write below, because sometimes patient may tear this paper and all, no, so you need to write discharge on request, that is discharge on request. Okay, discharge on request, and you need to take the signature here or anywhere in the this discharge certificate. Okay, otherwise it's almost same, that is one signature and another 2 signature where you will take, I will tell you later. Okay, so we start with this video. This is discharge certificate. Now discharge certificate you need to write which department. Definitely your department is the psychiatry department. Don't write short form, write full form. Okay, psychiatry, MRD नंबर, हॉस्पिटल नंबर, ये आपको कहाँ मिलेगा? MRD हॉस्पिटल नंबर आपको हॉस्पिटल में आने के साथ साथ मिल जाता है पेशेंट को। MRD नंबर इसके लिए अप्लाई करना पड़ता है, 1-2 दिन में हो जाता है। ओके, और साथ साथ भी हो सकता है एडमिशन के बाद। ये कहाँ मिलेगा? ये आपको मिलेगा MRD शीट में, दैट इज MRD शीट। हेयर यू विल सी MRD नंबर एंड हॉस्पिटल नंबर, यू नीड टू मेंशन here. Okay, now patient ka name, age, sex as well. Date of admission, that is also available in the MRD form, that is date of admission. Okay, and date of discharge you already know, and disease, remember this is the important for the psychiatry. For the disease we will never write the disease, we write only the code, and that code start with F, whatever it is, and it is ICD-10 according to ICD-10, that is important to mention. Okay, treatment we usually give conservative treatment. Okay, हम लोगों का सर्जिकल प्रोसीड्यूर यूजुअली नहीं होता है, दैट इज साइको सर्जरी टॉपिक, बट इट इज वेरी हार्डली डन इन एनी सेटअप. ओके, देन we very often give ECT, so conservative with the ECT, and you need to mention how many ECT. It may be 5, it may be 6. Okay, you need to write in the bracket. Now remarks, remember DOA, discharge on advice, and discharge on request में यही डिफरेंस है कि आपको रिमार्क्स में क्या लिखना है. अगर डिस्चार्ज ऑन एडवाइस आप कर रहे हैं तो दैट विल बी, पेशेंट विल बी इम्प्रूव, क्योंकि इम्प्रूव होने के बाद ही आप डिस्चार्ज ऑन एडवाइस करेंगे, राइट? डिस्चार्ज ऑन एडवाइस करेंगे, बट अगर आप डिस्चार्ज ऑन रिक्वेस्ट कर रहे हैं देन इट विल बी पार्शियली इम्प्रूव्ड इन डिस्चार्ज ऑन रिक्वेस्ट. ओके, नाउ आई एम रिमूविंग दिस स्पेस बिकॉज दिस स्पेस इज important for other things. Okay, I am just removing this. Why? Because you need to give some instruction to the patient also. What instruction you will give? Instruction you will give, right? Like a review for the coming for the review. Okay, to review in psychiatry OPD. Preferably if you write, you can mention 8 AM to 2 PM so that they can get the better service, or the consultant can see them. Okay, so this is the review in psychiatry OPD 8 to 2 AM with reports, because you will advise some reports, maybe if there is no reports is advised, so you won't write, and you will write within how many days, within 2 weeks or within 1 month, whatever the consultant has advised, you will mention. And also mention with proper attendant, because sometimes they come without proper attendant. No, it will be difficult, and they will say, oh, आप तो बोले नहीं है कि आपको प्रॉपर अटेंडेंट मतलब अगर फीमेल है तो फीमेल अटेंडेंट साथ में होना चाहिए. ओके, मेल अटेंडेंट है, वायलेंट पेशेंट है तो इसके साथ एटलीस्ट 2 मेल अटेंडेंट होना चाहिए. दिस आर द प्रॉपर अटेंडेंट का डेफिनेशन है. ओके, सो यू नीड टू राइट, दो स्पेस इज वेरी लिटिल हेयर, बट यू एनी हाउ यू नीड टू adjust with this space. Okay, now you need to give the medication. This is for the medication. Okay, this is for medication. Now here important thing is that the medication, patient may get 1 medication, patient may get 4 or 5 medication. You need to be very specific which medication you should write first. Remember which will be the most important drug or medicine for him, that should be in the first. Like if patient is in psychosis, antipsychotic will be in the first. Patient is in very much depression, antidepressant will be in the first. Then you can give some supportive like liver supportive, appetite के लिए आप कुछ दे सकते हैं, नींद के लिए कुछ दे सकते हैं. You need to write. Okay, this is according to the importance of the drugs you should write. This is very important. And another important, preferably you write the generic name. You write the generic name, and in bracket if you want you can write the brand name. You can write the brand name. Okay, then you need to like order the medication, then you need to put your how to use the medication. Like you can use cross 1 if it is in the night time only, or else you can write 1 tab. 1 tab means 1 tablet. It is better to write 1 tablet at bedtime. At bedtime for how many days? At bedtime for 1 month or 1 week, whatever it is they have advised, you need to write. And preferably it is after food or before food. After or before food, because bedtime means after food, or after lunch or before lunch, after breakfast or before breakfast. You need to mention it is in the in your prescription. Okay, and 1 or 3 4, sometimes you see patient is getting more medication, you have no space to write here 1 2 3. Okay, then you can write here also. You can write here also, but you need to keep some space here, because this is space for the signature of the 3 important person. Number 1 is case prepared by you, so you is the important person, you need to write. Remember your name will be important because you will be responsible whatever you have written. Okay, and along with the date you need to write. Then here register will check everything and register will send. Okay, then there will be counter signed by the BP. Now this is not a completed certificate. Okay, and this is the only first page. You need to come to the second space, divide the second space, because brief history you need to write all the chief complaints. What are the chief complaints with duration, how many days. Okay, with duration you need to mention. Then clinical significant finding, जैसे whatever the blood pressure, whatever the pulse rate, whatever the general physical examination and systemic examination you need to write here. Okay, investigation you will write along with the date. Why it is? Because like in 29 November they have done some important test. Remember all of the important test, and sodium, potassium, the electrolyte is very important. It might be in 29, it might be very less, like potassium is 1.9 something or else. Then the patient has received the treatment, and we have repeated on 1st December 2023. Here potassium was 3.4. So we can see the progress of the patient, and we can see by seeing the discharge certificate, we can see that the patient had dyselectrolytemia. So in future also, when patient will come or patient will readmit, then we can assess that patient might have some dyselectrolytemia because it has the previous history also. So this is very important, because some of the department they will write all the investigations are enclosed रहने से क्या होता है, patient के पास रहता है लेकिन patient will forget to bring that all these documents. But if they bring only this certificate and you have written nicely on this discharge certificate, you can at a glance you can see all the investigations there. So this is very important, you write all the investigation accordingly, right? This space is for mental status examination. If patient you are giving discharge on advice, usually mental status examination will be within normal limit. But if you are giving discharge on request, so there might be something in the positive finding in the mental status examination, but still due to the benefit of the patient or the benefit of the family, you are discharging the patient on request. So you need to write all this point. Okay, all the MSc finding you need to write, and below you put your signature, and before putting your signature, it is very important or very essential, or rather we can say it is very better to write the treatment received during hospital stay, received during hospital stay. মানে hospital में whatever the treatment he has received, like injection low pace, TDS means 3 times daily for 2 days मिला है, then BD for 4 days मिला है, HS for 5 days मिला है. Okay, then we can write, then injection thiamine or any other things, and that can be given. Okay, that can be given. So this is all about this discharge certificate, but you need to fill up the MRD certificate. MRD, date of admission is already there. You need to write date of discharge. Here you need to write the final diagnosis or the final diagnosis. Final diagnosis should be written in the word. That means like if it is alcohol, so mental and behavioral disorder because of the alcohol use, or currently on delirium with seizure and all. And you need to write the code here, whatever the code 10.414, whatever it is, you need to write code here, and according to this code you need to written, or you need to write all the details, means full diagnosis of the patient. Then operative procedure, you usually don't do any operative procedure, we go for the conservative, or preferably if it is necessary then you can ECT. Okay, and we can see, we can write here indoor register closed, because indoor register आपको बंद करना होगा, क्लोज करना होगा, क्योंकि any patient comes into the admission, okay, there will be indoor register, and I will talk about this. Okay, and here patient is discharged on advice. Okay, discharged on advice, you can write short form also, discharge on advice, or you can write discharge on advice. Okay, and what are the result after treatment? Patient is improved in case of discharge on advice, but if it is discharge on request, you need to write partially improved. So you need to write partially improved in case of discharge on request. Okay, yes, if you are giving DOR here, remember you need to take one signature there. So I talked about 3 important signature of the attendant in case of discharge on request, one in the discharge certificate, another in the MRD sheet. That is the MRD sheet. If you are giving discharge on request, you need to write the take the signature of the attendant with the full name and relation with the patient, If patient is unable to put signature, you need to take the left thumb impression, and you need to write it is left thumb. Okay, left thumb of the patient. And this is all about this MRD sheet. Here you will put your signature. You have done the very beautiful job. You need to write here, and then there will be whatever signature of the register, and there will be signature of the VP. Okay, so this is all about the discharge certificate. No, it is not completed, because you have closed the indoor register, but where is the indoor register? You need to find out the indoor register. Remember, any patient admitted in the indoor, there will be indoor register. There will be indoor register. Okay, now indoor register has divided into टू रजिस्टर हैं, वन एक है. ओके, कलर अलग अलग कलर का वो है. एक में मंडे, वेडनेसडे और फ्राइडे. ओके, नाउ another is whatever you will just see in the register, Thursday or Saturday, whatever. Now Saturday, Sunday and Friday, remember this is divided. Okay, because first Friday, second Friday, third Friday, it will be divided into, like it is first Friday or fourth Friday, it is first Sunday or second, this is fourth this is, sorry, no, the register is just divided the according to Sunday, or it is first, second, third or fourth. Okay, like one register will be for first and third, another register will be second and fourth, like that only you need to find out. Now इंडोर रजिस्टर में क्या क्लोज करना होगा? इंडोर रजिस्टर में आपको सबसे पहले MRD से you need to find out the date of admission, date of admission आपको निकालना होगा. Like if it is on 3rd 12/2023, that is on Sunday. Now if it is Sunday, then you have to find out it is which Sunday. It is preferably the first Sunday. The first Sunday preferably will it go to the this register. You have to find out this register. Okay, where is first Sunday is written. So you have to go to the register. There will be different column, okay, the different column, okay, and there will be serial number, name of the patient, okay, and there will be hospital number, there will be ward number, okay, ward number, and there will be diagnosis, treatment, and remarks, like that only. Now you have to write three important. What is the diagnosis? It will be pre-written by nursing staff. And you need to write down the diagnosis, you need to write down the treatment, whatever treatment you have given, and you need to write down the remarks. Like if it is discharge on advice, you need to put your signature with date, okay, with the date, like 3rd 12 2023. But if it is discharge on request, that Indo register also need one signature of the attendant, okay, attendant signature with relation. What are the relation with the patient? With the relation with the patient. So discharge on request, you need three important signature of the attendant. Number 1 on the discharge certificate, number 2 on the MRD sheet, and number 3 on the Indo register. Now your work is not done, something is left. What is left? That is left is your history sheet. Now हिस्ट्री शीट, देर विल बी वन इंडोर हिस्ट्री शीट, जिसका बेड होगा इसने हिस्ट्री लेके रखा होगा. इसमें आपको देखेंगे डिस्चार्ज ऑन एडमिशन और डिस्चार्ज ऑन एग्जामिनेशन एंड डेट ऑफ एडमिशन, डेट ऑफ एग्जामिनेशन एंड डेट ऑफ डिस्चार्ज रहेगा. नाउ डेट ऑफ एडमिशन एंड एग्जामिनेशन यूजुअली बिकम द सेम डेट ओनली, जिस दिन भी एडमिट हुआ है, लेकिन जिस दिन डिस्चार्ज हुआ है ये डेट आपको ये प्रीफिल रहेगा यूजुअली, और ये डेट आपको फिलअप करना होगा कौन सा डेट में आप डिस्चार्ज दिए हैं. इसके बाद इसमें नेम, एज, सेक्स ये सब रहेगा. इसमें एक चीज़ रहेगा जिसमें रहेगा आपका वार्ड नंबर, मतलब जो एडमिशन हुआ है इंडो रजिस्टर में इसका नंबर क्या है, क्योंकि उसी से हमको पता चलेगा कि जब भी हमको ज़रूरत होगा इंडो रजिस्टर में हम जाएंगे, इसी नंबर से हम ढूंढ के निकाल लेंगे. क्या होगा, जो इंडो रजिस्टर है, इंडो रजिस्टर में सीरियल नंबर है, हॉस्पिटल नंबर है, पेशेंट का डिटेल्स है, इसमें वार्ड नंबर भी लिखा रहेगा. जैसे मान लीजिए 13/23, मतलब 2023 में ये 13 नंबर पेशेंट है. इस रजिस्टर में आपको ये नंबर यहाँ से उठा के आपको इसमें लिखना है, वार्ड नंबर लाइक 13/2023. ओके, नाउ दिस इज वन. And another important in the history sheet, in the last page, what you will see, in the last page you will see there will be column of diagnosis. You will write the diagnosis and you will write case seen by BP doctor or whoever it is. Now what was the advice, whether advice for DOR or DOA, this is discharge on advice or discharge on request, you need to mention DOA या फिर DOR. Now what are the advice he has given? You have to write all the medication here. Okay, number 1, what are other advice? Now review कब करने के लिए बोला है? Review, REVIEW, review in psychiatry OPD after 1 month or 2 weeks, whatever it is, you will mention there, and below you put your signature. Now this register, your discharge certificate is almost completed. You need to either hand over to the sister, or you can go personally to the register to take their signature and to take BP's signature. You can personally also can go, or you can hand over to the sister also, they will get it done. Okay, so this is all about the history discharge certificate for this department. Okay, it is little different from other department. Other department they will never use the code, we will use the code, number 1. Number 2, we will write all this investigation. Most of the department they only write investigations are enclosed, but it is better to write here. Okay, it takes some time, but it will definitely good for everyone, for the patient also, for the doctors also. Okay, I hope this has given you some insight about the discharge certificate, but when you practically do it, definitely you will get it better, but in the first time you may it may take 35 to 45 minutes, not any big deal, because everyone needs some time to learn all this discharge certificate writing. Okay, I hope this video will serve you some purpose. Thank you.